Rewriting the environmental health narrative, how community voices drive sustainable change. When we talk about environmental health, what images come to mind? Scientists in white lab coats, policy documents filled with technical jargon, government agencies making decisions from afar. For too long, we've framed environmental challenges as problems to be solved by distant experts, haven't we? But today, I want to challenge that entire paradigm. I recently had the extraordinary privilege of interviewing Jamielah Cranshaw, a revolutionary force in environmental health whose work is literally transforming communities across continents. Her brilliance lies not just in her technical expertise, but in her profound understanding that environmental health isn't simply a scientific concern. It's fundamentally about people reclaiming their power to shape healthier futures. Jamila stands at the intersection of science, storytelling, and community empowerment, creating solutions that experts alone could never devise. This revelation challenges everything, absolutely everything, we think we know about addressing our most pressing environmental challenges. The traditional model positions communities, especially communities of color, as passive victims of environmental problems, waiting for experts to rescue them. But Jamila's groundbreaking work completely flips this narrative. She has demonstrated time and again that when local voices lead, when Black professionals bring their lived experiences to the table, solutions become not just marginally better, but radically more innovative, more sustainable, and more effective. Think about it for a moment. Who better understands the devastating impact of poor air quality than the mother whose child develops asthma from industrial emissions in her neighborhood? Who better comprehends the desperate urgency of clean water access than families who've lived with contaminated supplies for generations? These aren't just stakeholders. They are the true experts, the holders of wisdom that no academic degree can confer. This shift in perspective isn't just philosophical, it's transformational. And it rests on three fundamental principles that emerged with crystal clarity from my conversation with Jamila. First, your personal story is a powerful, no, an essential tool for advocacy. The experiences that shape your understanding of environmental challenges aren't just anecdotes, they're evidence. When articulated effectively, these stories can influence policies, shift entrenched thinking, and inspire collective action within communities that have been silenced for generations. Second, collaboration multiplies impact exponentially. Environmental health challenges are complex, intersecting with issues of racial justice, economic opportunity, and public health. Building coalitions across disciplines, public health professionals, business leaders, community activists, faith communities creates a momentum that no single entity could generate alone. This is how movements are born. Third, representation matters at every table where decisions are made. When Black professionals lead conversations on environmental health, solutions become more inclusive and sustainable because they're grounded in diverse lived experiences. This isn't about tokenism, it's about ensuring that those most affected by environmental challenges have meaningful input in addressing them. It's about justice. Let me share some powerful examples from Jamila's work that illustrate these principles in action. In Ghana, communities face serious, even life threatening health risks from lead and mercury exposure in local industries. The technical information about these dangers existed, but it wasn't reaching those most affected in ways they could understand and act upon. Recognizing this critical gap, Jamila partnered with Pure Earth to develop something revolutionary, a virtual reality experience highlighting exposure routes in Ghanaian industries. This wasn't just an educational tool, it was a bridge between complex science and community understanding. The immersive VR content was carefully tailored for both policymakers and affected families. The results were remarkable, even transformative. As awareness increased, stakeholders began prioritizing safer practices, and families, armed with knowledge, started advocating fiercely for cleaner work environments. What made this approach so effective? Jamilah's deep background in public health communication drove her unwavering commitment to making complex science understandable to everyone, not just the privileged few. The project earned international recognition as an innovative approach for grassroots education and inspired similar tech driven outreach efforts across West Africa, creating a ripple effect of empowerment. This powerful example demonstrates how culturally attuned storytelling can empower communities facing environmental hazards. It wasn't about experts swooping in with solutions. It was about equipping communities with knowledge they could use to advocate for themselves. This is the essence of true empowerment. Another illuminating example comes from Jamilah's transformative work as communications coordinator at NYU's Office of Sustainability. Many students felt profoundly disconnected from institutional sustainability initiatives due to cultural barriers and lack of representation. The environmental movement has historically struggled with inclusion, often failing to reflect the diversity of communities most impacted by environmental challenges. Jamila approached this challenge by developing targeted messaging strategies that reflected students' diverse backgrounds and lived experiences. She hosted forums specifically designed to amplify underrepresented voices on climate action. The outcomes were significant and far reaching. Participation rates among Black student groups increased dramatically, and new leadership pipelines formed within Green Campus organizations, changing the face of environmental leadership. What's particularly noteworthy is how Jamila leveraged her own experiences navigating predominantly white institutions as a catalyst for inclusive programming. Her efforts helped NYU win regional awards for diversity focused sustainability engagement and established a precedent that other universities began to adopt, creating institutional change that will benefit generations of students. This example highlights the critical importance of representation in professional spaces. Environmental initiatives that fail to include diverse perspectives not only miss valuable insights, but also perpetuate the very inequities they claim to address. This isn't just wrong, it's counterproductive. Perhaps most compelling is Jamilah's groundbreaking work as a fellow with the Children's Environmental Health Network. Here, she confronted a heartbreaking reality. Children of color experience disproportionately high rates of asthma triggers and housing related toxins due to systemic neglect that has persisted for decades. Rather than approaching this as merely a technical problem, Jamila facilitated workshops that united healthcare providers with parents from marginalized backgrounds. She translated complex research into actionable resources that families could actually use in their daily lives. The results speak volumes. Families reported dramatically improved home environments after implementing recommended changes, and local clinics began integrating culturally relevant materials into their care routines, transforming their entire approach. This work was deeply personal for Jamila, motivated by seeing preventable illnesses affect loved ones growing up in urban neighborhoods. Her contributions provided crucial data that policymakers used to craft new healthy housing standards and advance the national dialogue on closing racial gaps in child health outcomes. This is how systemic change begins. What these examples reveal is a fundamental truth. Environmental health challenges cannot be solved through technical expertise alone. They require the authentic engagement of communities most affected, led by professionals who understand both the science and the lived experience of environmental injustice. Anything less is destined to fail. This approach represents a profound shift in how we conceptualize environmental health work. It moves us from a model of doing things for communities to working with communities, recognizing their agency, wisdom, and power. This isn't just semantics, it's a revolutionary reframing that changes everything. The implications extend far beyond any single project or initiative. When we center community voices in environmental health work, we don't just address immediate challenges, we build capacity for sustained advocacy and change. We don't just implement temporary fixes, we transform systems. We don't just treat symptoms, we address root causes. This is the difference between charity and justice. This perspective challenges conventional wisdom about expertise and authority. It asks us to reconsider who holds valuable knowledge about environmental challenges and solutions. It invites us to expand our definition of evidence beyond peer reviewed studies to include the lived experiences of communities on the front lines of environmental injustice. This isn't about rejecting science, it's about enriching it. For professionals working in environmental health, this means approaching communities not as subjects of intervention, but as partners in change. It means recognizing that technical knowledge, while valuable, must be complemented by cultural understanding and deep respect for community wisdom. For policymakers, this means creating meaningful opportunities for community input, not just token listening sessions but authentic engagement that shapes priorities and approaches from the ground up. It means ensuring that those most affected by environmental challenges have seats at decision making tables. Nothing about us without us. For community members, this means recognizing the power of your own story and voice. Your experiences with environmental challenges aren't just personal struggles, they're valuable data that can drive systemic change when shared effectively. Your voice matters, your knowledge matters, your leadership matters. The beauty of this approach is that it creates solutions that stick because they're owned by the communities they serve. When people see themselves in environmental initiatives, when their concerns, values, and aspirations are reflected, they become invested in long term success. This isn't just good ethics, it's good strategy. This isn't just about better environmental outcomes, though those certainly result. It's about dignity, it's about justice, it's about recognizing that environmental health is inseparable from social equity. They are two sides of the same coin. As we stand at this critical crossroads of environmental crisis and social awakening, we must ask ourselves, will we continue with approaches that maintain the status quo, or will we embrace the revolutionary power of community led environmental health work? The choice is clear. The time for experts talking at communities is over. The era of communities leading alongside experts has begun. This is where true solutions emerge. This is where lasting change takes root. This is where healing begins for our communities, and for our planet. So I challenge you today. How will you use your unique story and your seat at any table to spark real change where it matters most? Will you have the courage to listen more than you speak? Will you have the humility to recognize expertise that doesn't come with credentials? Will you have the vision to see that environmental health is about people first, always? Your voice, your experience, your perspective aren't just valuable, they're essential to creating environmental solutions that truly serve all communities. The environmental challenges we face are too complex and too urgent to leave any wisdom on the sidelines. The future is being written right now, and you have a pen. Use it. Write a story of environmental health that centers justice, that amplifies silenced voices, that transforms systems. This isn't just our responsibility, it's our opportunity to create a world where environmental health is a right, not a privilege, where solutions come from communities, not just for them. This is the revolution in environmental health that Jamila Morand is leading, a revolution that invites all of us to participate, to contribute our unique perspectives, and to believe in the power of community led change. The question isn't whether we have the technical capacity to address our environmental challenges. We do. The question is whether we have the wisdom and the courage to center the voices that matter most, the communities living with these challenges every day. When we do that, we don't just solve problems, we transform systems. We don't just protect environments, we empower people. And that makes all the difference in the world.